Alright, for my third speech, I'm doing it on heart disease prevention. Now I'm going to introduce my audience to you. My roommate Carlo, girlfriend Brandy, another roommate Calvin, and my friends Connor and Todd. Alright, so for my third speech, I'm going to talk to you guys about the importance of early heart disease prevention as well as ways to reverse the effects of heart disease. You'll be surprised that there are many ways to keep a healthy heart besides through prescriptions and surgery, but through simple lifestyle changes. If all the parts of your circulatory system, the veins, the arteries, and capillaries, were placed end to end, they would stretch for more than 60,000 miles. That's more than twice around the earth. But one tiny blockage could bring all 60,000 miles to a halt. Doctors have always used many medicines and surgical procedures to keep the system running smoothly. But in 1990, a major shift began to publish a study that set out to test whether heart disease could not simply be prevented, but might actually be reversed. And he wanted to see if this could not be done without surgery or drugs, but with a diet and lifestyle change alone. The idea seemed possibly true to most. After all, at this time, heart disease was considered to be a one-way street unless it was treated with cholesterol-lowering drugs, heart pills, and when needed, open heart surgery. Doctor Dean Ornish, a Harvard-trained physician, studied 47 patients in the San Francisco Bay Area, all of whom had significant heart disease. That is, when the coronary arteries that brought blood and oxygen to their hearts were starting to narrow, pinching off blood flow and threatening the viability of their heart. That is, some had already had heart attacks, and the doctor assigned half of these patients to a control group that received the standard care that doctors usually prescribe, meaning a diet centered on lean meat, poultry, and fish, along with various medications and usual advice not to smoke. The remaining patients were assigned a very different kind of program. They were asked to follow 4 easy steps: a low vegetarian diet, a brisk walk for a half hour per day, or an hour walk for 3 times a week. Also, no smoking and stress management exercises. These patients were advised to follow a vegetarian diet because cholesterol and saturated fat are found mainly in animal products. On this diet, they were required to exclude red meat, poultry, and fish, virtually eliminating cholesterol and animal fat. It reduced all sources of fat, including vegetable oils. Also, these patients did not take any type of pharmaceutical drug to reduce heart disease symptoms. The program consisted only of simple diet and lifestyle changes. 1 year later, all patients had an angiogram, a special x-ray that reveals blockages in the coronary arteries, and results were compared to the same sort of test done at the beginning of the study. The results made medical history. The control group patients who had been following the more traditional medical routine did not generally improve. In fact, the blockages in their coronary arteries even worse. On average, at the beginning of the study. They still had chest pain and still needed medication. That was not news to the doctor. Despite typical heart treatment, heart disease usually worsens as time goes by. For the patients in the experimental group, however, their story was very different. Chest pain began to disappear within weeks, their cholesterol levels dropped dramatically, and their coronary arteries, which had been gradually closing off year after year, were actually starting to reopen. In fact, the effect was so great that the angiogram showed clear evidence of reopening in 80% of the patients in the first year. These results were published in The Lancet in 1990 and gave doctors a new tool for reversing heart disease. The program cost much less than surgery, was surprisingly easy to follow, and could help keep patients healthy over the long run. The only side effects were good ones. The average patient lost 22 pounds in the first year. 3,000 Americans have heart attacks every day, 40% of which are fatal. Those who survive often go on to have another heart attack later on. Every day, nearly 2,600 Americans die of some type of cardiovascular disease, including heart attacks, strokes, kidney disease, which is caused by blockages in the arteries to the kidneys. This means that there is death every 34 seconds among them. But it does not have to be this way. After learning what we have from these doctors' research, it is clear that heart disease is not inevitable. It can be prevented and even reversed. But first, everyone needs to understand what exactly heart disease is. Common heart disease is the growth of plaque on the side of the arteries. This plaque is made up of cholesterol, fat, and cells overgrown from the artery's muscle layer. These plaques can begin to form during young adulthood, sometimes even as early as childhood. It requires major changes to your lifestyle to reverse these effects, but it can be done. By now, you might be asking, is this happening to me? Well, I'm going to walk you through how to determine if you are at risk. Here are the major risk factors. The first is high cholesterol levels. A good cholesterol goal is levels around 150, and normal is about 200, but that increases the risk. The next risk is high blood pressure. Ideally, your blood pressure should be less than 120/80. Next is excess weight. 65% of all Americans in the adult population are overweight or obese. Extra weight increases the risk of heart disease. Another is diabetes. Both type 1 and type 2 diabetes heighten the risk of heart disease. Smoking wreaks havoc on your blood vessels and heart, making heart disease that much more probable. And the last is family history of heart disease. If heart disease runs in the family, it can mean that you share the genes that increase the risk of heart problems. Besides these major factors, there are also a few lesser causes that can also contribute. These include chronic stress and increased age of 45 in men and 55 in women, and also gender. Men are more likely to develop heart disease over women. Cardiovascular disease is the leading cause of death in both men and women in the United States. If you have more than one of these risk factors, this is the perfect time to consider making some changes. This is why I chose to talk to you guys today about this. Now that you know what the risks are and what you should be looking for, what should you do to avoid these? What kind of changes need to be done to your lifestyle? Let's focus on cholesterol for a minute. In Farmington, Massachusetts, the Farmington Heart Study has spent many decades tracking who gets heart attacks and who doesn't. Among its key findings is that the lower your cholesterol, the lower the risk of heart problems. While some authorities say that 200 milligrams to be the boundary between desirable levels and high levels, the Farmington study shows that the lower your levels, the better. The risk drops dramatically around 150. In decades of research, not a single person in the Farmington Heart Study with a cholesterol level below 150 has ever had a heart attack. So ideally, our cholesterol levels would remain under 150 based on this research, as opposed to the arbitrary goal of 200. The 200 goal for cholesterol was set because it is a nice round number and is very close to the average among Americans. The problem is about one-third of heart attacks occur in between these levels. To bring your cholesterol down, the first step is to know where cholesterol is and how to avoid it. Now, cholesterol is not the same as fat, the fat that you see around the edges running all through a raw piece of meat. If you had cholesterol on the tip of your finger, it would look and feel like a waxy material. It is a raw material made in the cells of all animals, including human animals. It is used to make cell membranes and hormones, among other functions. But particles of cholesterol are microscopic. It lurks in the cell membranes of the muscle cells that make up chicken breasts, salmon fillet, and also red meats. Surprisingly, it mainly resides in the lymphoid. Cholesterol in foods you eat raise your cholesterol level, and animal products are the only significant source of cholesterol in the diet. But here's the thing to remember: when you eat animal products, you're ingesting that animal's cholesterol. In the cell membranes of animal cells you are eating, which are then added to the cholesterol that you naturally produce. It's easy to know where cholesterol is found because it's in all animal products. Cholesterol is different from fat, but fat is easy to get from. Saturated fat stimulates your body to make more cholesterol. Saturated fats are sometimes called bad fats. Their name comes from the fact that fat molecules is completely covered with hydrogen atoms that is saturated with them. If If it is not covered with hydrogens, it is called unsaturated fat. Saturated fats stimulate your liver to make more cholesterol, while unsaturated fats do not. Luckily, you don't have to be a chemist to identify these saturated fats. They are easy to spot because they are solid at room temperature. Unsaturated fats are liquid. Picture the difference. Imagine pouring a frying pan full of hot bacon grease into a bottle, and you'll see what happens. It gradually cools down and turns into a waxy solid. Vegetable oils, on the other hand, when they are at room temperature, they are liquid. Animal products contain substantial amounts of fat, especially saturated fat. In contrast, nearly all fruits, vegetables, whole grains, and beans are very low in fat overall, with little saturated fat. So the best way to lower your cholesterol is to avoid animal products completely. This is why doctors use a vegetarian diet to reverse heart disease. Plants contain essentially no cholesterol and no animal fat. Some doctors still will recommend chicken and fish diets, but these diets are not very effective. They lower the amount of bad cholesterol in your blood by about 5%, but a vegetarian diet typically has about 4 times more calories, lowering your bad cholesterol by a good 20%. Now that we are aware of these issues and where they come from, you can start trying to keep a healthy heart. You can start by making simple changes in your current favorite meals. The most powerful way to stay healthy is to put the right fuel in your body. That means a menu filled with high fiber, low fat, and vegetarian foods. With some simple mealtime ideas and a few tips on how to jump into a healthier way of eating, you will be equipped not only to save your own life, but to spread a life-saving message that will help you as well as your loved ones. Okay, that is my speech. Now I'm going to ask my audience if they have any questions. Anyone have any questions? Alright, thank you very much. That is my speech on heart disease prevention.